Hi, I'm Donna Tregilia. I'm a nurse practitioner and the coordinator of the wound care program at Gaylord Specialty Healthcare in Wallingford, Connecticut. I am a certified wound care nurse by the Wound Ostomy Continence Nurses Association, as well as an adult nurse practitioner and clinical nurse specialist. We're really lucky here at Gaylord to have two other wound care certified professionals, an RN who is a certified wound care nurse, and a physical therapy who is a certified wound care specialist. One of the big advantages of our program is that having myself as a nurse practitioner and having prescriptive authority, when we see a patient and recommend a treatment, the orders for that treatment can go into our electronic medical system immediately, so there's a seamless care as it relates to the patient's wound care. The other thing is that we do have access of a lot of other clinicians within the hospital that we deal with when we need to. The dietitian, the pharmacist, the informatics nurse, as well as our collaboration with the physicians and our consulting plastic surgeon, who we deal with mostly with our flap patients and those that need surgical debridement. Because of our population of patients has changed so much over the last few years to those that are very medically complex, we have had more complex wounds to care for here. Many times our patients and family members will ask how often they will be seen by the wound care team, and the process that we use here is by consultation, which can be called upon by many members of the medical team. The physician or mid-level providers who are admitting the patient can put an order for a wound care consult. The nurse who's admitting the patient sees a wound that really could use the benefit of the wound care team. They will contact me. And actually there's a process in our electronic medical system that alerts me to a patient with a significant wound. So upon that initial evaluation, we would come up with treatment recommendations. And ideally, we like to collaborate with the medical provider and the nurse at the bedside to evaluate the patient together, so that we're all seeing the same thing at the same time and making a decision and a discussion about the treatment options. As part of our wound assessment and consultation, we look at the wound, but also all the contributing factors related to that wound. We review the history and physical, what medications the patient's on, their laboratory values, are they anemic, do they have diabetes, is the diabetes in control, things such as that may put the patient at risk to develop the wounds and also can stall the healing process. We work with the medical treating team regarding these risk factors and any of them that can be modified. One of the other things that we have here at Gaylord are protocols for caring for most of the common types of wounds that we see here. The wound care team also works along with the nursing staff and other clinicians in providing patient and family education regarding risk factors associated with wounds, as well as wound care treatments. Many times the patient will go home with a wound that needs to be cared for by a family member, and we help provide some of the education. Just as a note, one of our newest wound care treatments that we've been using over the last several months is called platelet-rich plasma gel. It is used for a very small select group of patients, and we have been receiving very good results using this treatment. Just as a reminder, this is an inpatient wound care program, but if you have a question about our program, please feel free to call me, Donna Tregilia, at 203-284-2800, extension 3348.